New Ebola cases continue to pop up in the United States. Now, individual states, including New York, are taking extra precautions to make sure they're ready. WENY's Leanne DeRosa joins us live in the studio and has the story. Leanne?
John, Governor Cuomo announced today that he feels New York is ready to tackle Ebola, and today he designated 8 specific hospitals across the state to treat the patients. That is, should the disease ever make its way to our neck of the woods.
Upstate University Hospital in Syracuse and University of Rochester Medical Center are the 2 closest to our area. But there's also Mount Sinai, New York Presbyterian, and Bellevue in Manhattan, Montefiore in the Bronx, North Shore LIJ Health System in Nassau County, and Stony Brook University Hospital on Long Island. Cuomo said these hospitals will go through training and drilling to make sure the go-to teams are fully prepared beyond the level that local hospitals say that they're prepared.
Any hospital anywhere in the U.S., if they have a confirmed case of Ebola, we will send a team to the ground to be there with them for every aspect of the care, from infection control to treatment to environmental decontamination to waste management to training of staff.
This all comes after more Ebola cases are showing up in the United States, including a man in Lubbock, Texas, and a patient at Yale New Haven Hospital in Connecticut who both show Ebola-like symptoms. So far, 2 nurses who treated Thomas Eric Duncan have confirmed cases. Nina Pham was transported to a hospital in Maryland, and Amber Vinson is at Emory in Atlanta. However, more cases could pop up, since Vinson flew from Dallas to Cleveland, Ohio, only days before she was diagnosed.
My understanding is that she did contact CDC, and we discussed with her report of symptoms as well as other evaluation. My understanding is that she reported no symptoms to us.
But now the CDC says she had a low fever, and they can't rule out the possibility she had symptoms before her first flight on Friday. Now people in the Akron and Cleveland areas and those on Vincent's flights or who flew on the same plane this week are on alert. Ebola is causing nationwide anxiety.
But because of the medical infrastructure that's in place in this country, because of the way that we know the Ebola virus is transmitted, people can take some solace in understanding that the risk of a widespread Ebola outbreak in the United States is exceedingly low.
Today, several lawmakers suggested a partial travel ban. However, Frieden of the CDC says current screening systems helps monitor the situation. And if flying is not an option, people will find other ways to travel to the U.S. and the screening system would fail. Today, more airports, including O'Hare, Newark, and Dulles, have amped up their screening processes, and it's doubtful it'll stop there. Reporting in the studio, Leanne DeRosa, WENY News.